is Jeff Spoonemore, and I've had some patients come in with concerns about colic. Their children have had colic, colicky behavior, and first of all I want to define what colic is. By the Mayo Clinic defines it as colic truly is defined as 3 episodes a day for 3 days lasting at least 3 weeks, if that makes sense to you. So, but all kids can be colicky. Colicky is just generally a fussy baby. Now what we want to try to do is when I have patients come in is try to define when they're fussy. So I always recommend my patients, we start this process down this road, is we try to keep a diary. We try to keep a diary of when the babies would be fussy. Then we can kind of isolate, is it morning, is it afternoon, is it night, is it maybe a food allergy, maybe it's a breakfast food allergy, maybe it's something they're getting for lunch, maybe it's something in the evening. But we can kind of decide, we can start going down a path or a direction as to what might be causing the fussiness that the child is having. Remember, children get fussy for many different reasons, as you all well know. It could be anything from their scratchy clothes, maybe their pillows are aggravating them at night and they wake up cranky. As a chiropractor though, we do like to assess the spinal alignment. And that would be, we do just a spinal analysis. We look at the spine, we look at the neck and mid-back and lower back. Sometimes the colic could be because the child had a traumatic birth and we needed to check their neck. Maybe their neck is misaligned, maybe they're having a neck ache, a headache per se, low back pain. It can really set us off and put us in a bad mood. Well, the only way a child knows how to tell you they're in a bad mood is to cry. And so the colic can be many different reasons, but a bad back or a sore back, neck, headaches, all of these can definitely be a precursor to a colicky baby. One thing that I always want to make clear to my patients as we talk about colic is there are some warning signs. If you see a baby that's crying and they start to turn blue, maybe their tummy gets really hard or inflamed, there are warning signs that maybe they're having some intestinal problems, some breathing problems. Those are definitely more emergency room, medical doctor type problems. So anything like that, you feel their tummy, it's really bulbous and hard. That may mean that they're not going to the bathroom the way they need to. And the bluing of the lips, bluing of the skin. Those are different type of warning sign that you want to be aware of. But if this baby, if you're having problems with colic, your chiropractor is a great advocate to kind of get a diary going, trying to look down a path to what actually might be causing some of these problems.